Hi, everyone. Thank you for joining us tonight. My name is Joe Kelly. I am the program host for the Community Relations Department at Rochester Hills Public Library. Tonight, I'd like to welcome you to this evening's program, What Impact Does Elder Abuse Have on You? With Melissa Mahoch of the Disability Network of Oakland and Macomb. So before we get started, I'd like to say a quick thank you to the Friends of Rochester Hills Public Library for helping to make these programs possible through their many fundraising efforts. We greatly appreciate their support, and we encourage you to register for our upcoming programs, including next week's Culture and Identity, which is co-hosted by the Rochester Area Youth Assistance, RAYA, on Thursday, February 18th at 7 p.m., which you can register to via calendar, visiting the page on calendar.rhpl.org. But for this evening, attendees will remain muted throughout the program, and if you have any questions, you can feel free to leave those in the chat. The program itself is being recorded, and it should be posted, edited, and uploaded onto our website and YouTube channel about by next week, so next Thursday. But with all that being said, I'm going to pass it off to our presenter tonight, so everyone please welcome Melissa Mahoch. Melissa, please take it away.
Hello, everybody. Thanks for taking time out of your evening schedules to join me here. A quick note, I have a 3-year-old that might Zoom bomb us, so that's who might just pop in to say hello to everybody. One of the dangers of working from home these days. First and foremost, I want to say thank you. Secondly, I want to say my name is Melissa Mahoch. I come to this kind of work from not only a very a background in mental health and specifically gerontology, but also my grandmother was experienced financial abuse multiple times by somebody who posed as a bank employee and all this good stuff. So I come to this material not only from a very professional sort of standpoint, but also that personal lived experience as well. I am rather informal when I present, so if you have any questions, feel free to drop them in the chat as we go along, and I will do my best to address them as I go along. I don't, although Joe may have another idea about this, I don't mind if you unmute yourself, especially since we're a small group, and just speak up. That's fine with me too. So it's up to you. I'd rather make sure I answer all the questions. Go ahead, Joe.
They're actually, they won't really be able to unmute themselves, but if we want to go ahead and have a question area where we ask questions and, people want to basically raise their hand, there he is.
Yes. Yes, hello, Kitty.
But people want to, essentially leave a comment I'd like to answer or something like that. We can unmute them, or we can change the ability to unmute around a question portion. I would just prefer to leave that ability to unmute and mute off just to avoid any accidental audio hiccups or anything. But for the question portion, we can definitely do that. I would just keep probably a spotlighted video on yourself while we do that, but unmuting is something we could totally do for a question portion.
Okay. Works for me. I'm pretty flexible when it comes to this kind of stuff.
Great.
In the chat box, you will see that I have included a link that is for an evaluation. I do have to make a report to my funding sources about sort of how this is going out in the community. So please do me a huge favor by completing that. I like all kinds of feedback, so don't feel you have to respond in a certain way.
I left a duplicate of it just in case it didn't pop up for everyone else.
Thank you. If for some reason that doesn't work for you, my very last slide has my contact information as well. Just send me a quick email and I'm happy to forward that to you. All of the housekeeping stuff out of the way. I do want to start off by talking about, tonight our topic really is the impact of abuse. I'm gonna, spoiler alert, it impacts us all. I am going to walk through a little bit about what constitutes abuse, because I find there's a lot of misconceptions out there, as well as why somebody might not be super excited to leave that situation. and also some of the specific cultural or identity kind of things that sometimes impact people's ability to access resources. And then finally, I'll talk a little bit about the resources that are available in this area. Without further ado, I'm going to share my screen, and let's hope it works just as well as it did before. Hold, please. There we go. Ta-da! Like I'm a professional or something. All right. So let me move this little box out of the way. I always feel like the Zoom box is in the wrong place. It doesn't matter when or where I'm at. Okay. And also, maybe ta-da, there we go. Wasn't responding for a second there. So I would be remiss if I did not thank my funding sources. This project, this work has been funded for several years. Initially was funded for about 5 years through MDHHS, their Aging and Adult Services Office, and just recently got picked up by a AAA-1B through their PEAN grant there, both of which targeted elder abuse awareness in Southeast Michigan. Okay, so I am from Disability Network Oakland and Macomb. A lot of people have some questions about that. We're a nonprofit. We serve everybody, all kinds of disabilities. We serve all ages. However, I will tell you the majority of our clients are probably high school age, middle school age, and older. And that includes everybody up until, 90. I think our oldest consumer was 100 maybe. So really we span the age range. Our goal, we abide by independent living philosophy, which means that we believe that everybody has a right to determine as much as they want the course of their lives. And everybody has the right to live as independently as possible. So that kind of underpins all of our work. You can see some of the areas, core service areas that we have. We are in the process of redoing our website, so if you do check it out, which is www.dnom.org, you will see some things will shift around. And that's really just because it's been a few years and things have changed dramatically in the last 11 months. So, so those things will all change. I believe that's all I wanted to say. Oh, one important thing about our agency is that sort of part of our Center for Independent Living status is that at least 51% of our staff, they themselves have at least one disability. So chances are really high when you're talking to us that you're talking to somebody who has a disability, who has that lived experience, navigating systems and all of that good stuff. All right. So because you're here, I'm assuming that you probably have, and you know what they say about assumptions, but I'm assuming that you probably have figured out that we do have an abuse problem. It's worldwide. It's not just us. It's everywhere. One of the really important things I want to make sure I mention, and I will say this over and over again, is that I am talking specifically about elder abuse tonight, but please do keep in mind a lot of the things that we talk about may also impact younger aged folks. Abuse is abuse. The federal government defines it as 65 and over. Because something magic happens when you're 65. I can't explain it. Don't ask me to, because I don't know, to be honest with you. But for some reason, that makes it elder abuse. So thank you for taking the first step by becoming a little more educated, not only about the global problem, but also specifically what's going on in our particular area. So, 60 and over, I'm sorry. I said 65, it's 60 years and older. So the federal government defines it as abuse that occurs to somebody who is 60 and over. That can be some violation of a relationship of trust. or expectation. And you'll see that the state of Michigan, our particular definition follows very closely with the federal definition. And also, what's interesting about our Michigan definition is that it's not only harm, but threat of harm that causes it to qualify as, oh, sweet, I just looked at the chat and I noticed somebody is estate planning and probate lawyer. So woo-hoo! Thank you. You guys are awesome. I love working with y'all. Y'all are such a fantastic group of people. Yes, we are going to get to resources that you can refer to. Absolutely. I would totally be remiss if I did not provide that. So we will get there. So you have some idea of what abuse looks like. You probably have come across financial abuse, coercion, undue influence, things like that. Fun fact, I used to do evaluations for attorneys who were working in elder law, who they had a question of undue influence with family members or somebody else in the older adult's life, or just ability to execute the document. So I have a long history with probate and estate planning, and there we go. It's really lagged for some reason on here. All right, so as you have some sort of familiarity with abuse, I could start off by telling you the 5 types of abuse, and yes, that's all very important, and we will get to that. However, what I come across most often and what I hear people talk about most often is not those clear-cut signs of abuse. What I come across often is people say, you know, my friend, my neighbor, I have, you know, in the last 3 months become really withdrawn. I've become very depressed. I can't remember anything. And when you start talking to them, you find out that those onset of system or onset of difficulties also coincided with a new person in that person's life, or a change in decision making in that person's life. And so, but it's often these kinds of things that people find more troubling, maybe, or that as service providers, sometimes we run across a little more frequently, maybe. Now I'm just admitting people left and right here. All right. Now, coming from a mental health background, I don't know if anybody else has that kind of a background, but when I look at this list of stuff, in my head, I'm thinking of 10 different possible diagnoses that might apply here, right? I see depression, I see anxiety, I see cognitive impairment, I see delirium, I see dementia, I see psychosis, I see all kinds of things, right? So just because you see somebody with these kinds of symptoms doesn't necessarily mean there's an abuse situation happening or that they are experiencing abuse, but it could be. And I would, if I was a betting woman, which I'm not because I'm terrible at it, but if I was a betting woman, I would say once you start to see multiple of these signs, that starts to make me wonder a lot more about what's going on. So there are 5 types of abuse, which I alluded to earlier. So there's physical abuse, and that's what this slide really indicates. So it's this wheel, and you see all these different kinds of symptoms that take a piece of this wheel, like bruising, unexplained fractures, bleeding, scratches, black eyes, things like that. And I think that's what a lot of people think of when they think of abuse. Of course, not our probate and estate attorneys, but commonly, I think that's what I often run across, and that's true. And physical abuse is a crime, just like psychological or emotional abuse. That's a crime. It's prosecutable in a court of law, just like neglect, just like sexual abuse. So you get the idea, right? So all of these are crimes. They're all very important to be aware of. Obviously, I can't capture everything. Everybody has a different experience of abuse. Pardon me. I do want to focus on, or just kind of point out some things about emotional abuse, which is what this slide is really about. As I was going through and researching, it occurred to me that emotional abuse, kind of the common signs that we see, often fall under these sort of three groups, these three headings. So things like general harassment, right? That's the humiliating remarks, you're so ugly, you're fat, nobody's gonna want you, things like that. And just lacking emotional support. And then we also have controlling activities. That's like your intimidation, the isolation, the manipulation. I often run across this as, oh, I'll take care of that for them. I'll take care of that for them. No, you can talk to me about it, right? And that's how people who are perpetrating abuse start to whittle away that support, right? If you gradually isolate people and then you gaslight them, which basically gaslighting is, it's hard to explain. I can't think of a good succinct definition, but essentially making somebody think they're crazy, like making them think that they don't know, they didn't interpret things correctly, they didn't have the same experience as the person who is the abuser. And in general, just erodes their sort of self-confidence, if that makes any sense. I'm happy to further elaborate on it, but I do want to make sure I get through everything tonight. I could talk about this forever. Nobody wants to hear that. So, and then also the verbal assaults as well. So it's the yelling, the swearing, things like that. A lot of times when we talk about domestic violence or intimate partner violence, emotional abuse sometimes is at the forefront of what people are comfortable saying. But hidden underneath that might also be some physical abuse. There might also be sexual abuse. There might also be all kinds of stuff. Financial abuse, doesn't matter. Okay, I'm going to leave that. We're going to hop into sexual abuse. Now, this is one of those things that I know that there's a lot of misconceptions out there. Just to be clear, sexual abuse is not a bad decision. It's not regrettable interaction with somebody. Sexual abuse is sexual contact without consent. That's what it is. Plain and simple. So it includes things like sexual assault or battery, rape, sodomy, unwanted touching, explicit photographs, and yes, I do have to make the disclaimer, explicit photographs without the person's consent. So it can include lots of different things, but the key is really that without consent. That's what makes it a crime. Okay, so financial abuse, I'm going to move to that. Normally I pause and ask for questions, but if you have any, just again, drop them in the chat box for me. This one really sums up financial abuse. So when I get a call from somebody and they say, I don't have any money to do whatever, and when I talk to them, it appears from the outside that they have enough money to accomplish what it is they would like. Yes, I'm sorry, I'm pausing because I'm seeing that somebody dropped in the chat box that one way to describe gaslighting is making the other person doubt their perception of reality. Yes, definitely.
I'll quickly shout that. That's from my girlfriend. She overheard.
Thank you very much. I totally needed that. Thank you.
Yeah, she's been up on stuff like that, so.
Cool. She's amazing. Tell her thanks for me.
Absolutely.
Yes, that is gaslighting. It's not fun to be on the receiving end of it, as anybody who's been in an abusive situation can tell you. So one of the things that in financial abuse, I always start asking is somebody else paying your bills? And are they actually paying your bills, right? Because a lot of times I see people say they're paying bills, but they're not, or they're not completely, or something along those lines. But it's an informal arrangement so that there's no paper trail, there's no official names listed on the accounts. So sometimes I run across that. And the same thing, sometimes with, I've come across this a couple of times with publicly appointed guardians, and that I've had a person who tells me they're not getting the sort of monthly stipend that they normally would get because their publicly appointed guardian hasn't given that to them yet. So asking, are you getting the money that you're supposed to get? Not are you getting all of it, but are you getting the money that you're supposed to get, right? Do you have the necessities? If you're telling me you have $2,000 coming in a month and you have no mortgage and your rent, maybe your house is paid, which often I run across that situation, and you don't have enough money to go to the store to get food, I'm going to start asking some more questions about what else is going on. Not because I care how you spend your money, but because I want to make sure that you are the person who's actually spending your money, not somebody else without your consent. So hopefully that makes sense. But it also can be things like forcing people to sign things by force. Sometimes I hear people say, I don't know, I signed some papers, so-and-so, on my adult child, my partner, my spouse, whoever it is. They brought me these papers, and I didn't have time to read them, so I just signed them, right? I always, especially when I was doing informed consent for services and things like that, I always would tell people, look, if you have any questions, let me know. You can take as much time as you need to read through this. I'm happy to paraphrase anything. I don't want you signing anything that you don't know what you're signing. So sometimes these things are indicators that abuse might be happening. And again, not one, not two, but if you start seeing repetitive signs, or you start, a lot of times I encourage people to listen to their gut, to tell them, do things make sense? Are they hanging together? Because if not, that might be a sign. Okay, now I can't seem to forward here. Ah, there we go. Woohoo! Sometimes it gets hung up. All right, so neglect. This is a tough one. It's a really tough one. And in this particular case, what I'm talking about with neglect is really neglect by somebody else, not necessarily self-neglect. I often hear a lot of people calling about self-neglect, and yes, that is problematic as well, but for slightly different reasons than this neglect by somebody else. So sometimes I hear, oh, isn't this just bad decision making, right? Maybe. And again, as I was doing research, it appeared like these kind of set into three categories. So neglect kind of is comprised by an absence of things, right? Do you have untreated medical conditions? Do you have enough food? Do you have enough liquids? Do you have enough, if you wear incontinence briefs, do you have enough? Or are you having to reuse, which kind of gets into that cleanliness sort of section. There are other things that comprise that section, things like not being bathed, but needing help to be bathed. If you have in-home help, but they're not cleaning things, that can be a source of neglect. And then sometimes I see sort of the effect of neglect as hoarding, and in this case, I do want to make a distinction. When I use hoarding here, it is not DSM-5 clinical diagnosis hoarding, more commonly used word for hoarding. I just want to be clear about that. So hoarding in response to not knowing when you're going to get stuff again, right? So you may, grab all the toilet paper is a classic example I give because I've run across that. So you may hoard, you may be picking up rolls of toilet paper from doctor's offices or other places, not because you have some sort of mental health thing happening, but because somebody else controls your money and somebody else brings you the things that you need, groceries, supplies, things like that, and that's getting few and far between, and you don't know when they're going to come again, and you want toilet paper. Seems fairly reasonable to me, but sometimes I do run across that. So before we hop into research, I do want to check here. Yeah, I'm checking the chat room. So yes, so there are some concerns about accessing services to remedy abuse during COVID. Huge problem. And I'm going to go light on the research. If you want more and geek out about numbers, I'm happy to do that. But I do want to make sure I cover very thoroughly resources, how to go about, how to start detecting when things are happening. Okay. All right. Whew, I made that. I'm going to skip this one really because basically it just shows we're getting older as an American society and that we have fewer people who are younger to support our older adults. That's a trend that's going to continue through the baby boomers. In my family alone, we have 4 kids, but we're all in different areas of the country. And all of us are, no one is closer than 4 hours from my parents. So it's not like I'm going to go run by after work and check on you kind of thing. So people as they age are losing those kinds of supports. That's really it. I do want to point out 2 really key risk factors for experiencing abuse. So disability status, and then also, and I don't know that I necessarily am going to go into this quite a lot, but also identifying as anything other than heterosexual and cisgender male, female. Also is a risk factor for experiencing abuse, among other things like trauma and that kind of stuff. So we are going to talk a little bit about that, but I just want to go ahead and set that stage here. You can see a lot of these statistics are pretty terrifying, to be honest with you. One of the scariest ones, I think, maybe, and this is just my opinion, is that adult women of all ages, about a third of us experience sexual abuse in addition to another type of abuse. So sexual abuse in addition to financial abuse, physical abuse, emotional abuse, neglect, one of the others as well. That's kind of unacceptable. And we do know that one of our risk factors for experiencing abuse as we age is previous trauma. So if you've experienced abuse before, it's reasonable to that might be a traumatic event and therefore make it increase your risk for experiencing abuse. Okay, so the impact of abuse, it's a lot. It's a lot. all of these things and more can be impacted with it. A lot of people ask me about housing, and I give sort of the scenario I come across not infrequently, which is I work a lot of times with folks who have limited incomes. And sometimes those people have worked really hard to get housing that they can afford. And sometimes they have invited or continued a relationship with somebody who's abusive towards them for a number of reasons. But now they live together in this low-income unit, but that unit is under the person's name or under both of their names, but there's abuse going on. Where is our person going to go? Right? Where is our person going to go? And if that person uses a wheelchair or has some sort of mobility issues, I can tell you, I know of one part-time shelter that is accessible for somebody with a mobility disability in our area, and that's not a lot. So sometimes housing can, sometimes people stay because it's easier, right? It's an expensive problem, not just the financial abuse, but all around. Any abuse is expensive most often, and you probably have heard those statistics somewhere along the way, but most often the perpetrator of abuse is somebody well known to the person. So a family member, a neighbor, a caregiver, something like that. It's somebody who's well known to the person. It's not, you know, we'd like to think of it as a stranger, but the reality is that's just not what happens. And again, I do want to make sure that I mention that these statistics, these numbers are coming from reported cases, which we also know that abuse is historically underreported. So these numbers are likely underestimates of what's actually going on in our area. We have a number of risk factors for abuse. I point these out because they also serve as places that we can start to intervene. These are places we can start to have some impact for the person. And so sometimes these knowing, oh gosh, I skipped forward, now it's working just fine. Sometimes these places can help us kind of figure out what kinds of resources we need to pair with the person. Yeah, that's all I want to say about that, because I definitely want to move on to questions and resources. All right, so you're all here. Thank you for taking the time once again. I certainly am trying to do my part in terms of raising awareness and working with people to eliminate abuse in their lives. Each one of you has a role to play, so thank you very much. So resources, this is the part I want to start with here. Start with, that's not what I mean. So these are some of the resources. Now these are not exhaustive. And you know, some of these resources are not going to be accessible for everybody because of certain circumstances in their own particular situation, right? So I think one of the biggest resources and often overlooked resources is ourselves. And it may sound like a tall order, but if you've ever talked to somebody who has been in an abusive situation, you know, just listening, non-judgmentally, not with the intention of fixing, not with the explicit intention of doing something about it, but just listening, sometimes that is the greatest source of support for somebody who's living in an abusive situation. And I think one of the keys to that is really accepting that the person is the expert on their own life. So what I mean by that is they know they've been living in that situation for more than just a little bit. They know where the boundary is. They know how far they can push. They know what repercussions are for which behaviors, right? they figured it out because they're still alive. And so sometimes when I talk to people, they tell me, oh, no, that's not going to work in this situation. And that's it. That's all I get, right? I don't get a reason. I don't get any of that. And sometimes you hear it termed resistance. Yes, it is, but it's resistance because there's an instinct to survive, right? And sometimes the person is the best expert. We don't know what it's like to live in there every day, day in, day out, regardless of what else is going on in this wide, wide world. And so sometimes just accepting that they themselves can tell you the limits and the boundaries of what they're comfortable and what they're actually able to try. Sometimes that helps provide that direction to providing resources. For those who are familiar with trauma-informed counseling approaches, you'll find that this is sort of a very comfortable place to be for you. And then once we sort of start there, then I think it becomes really easy to start plugging in and connecting to resources. So for instance, if somebody, I think one of our participants today has a relative who's in a facility, nursing home, I believe, and please correct me if I'm getting this wrong. But in those cases, each facility has an ombudsman whose sole job is to address, in the resident's best interest, from the resident's perspective, address disagreements between the resident and the facility. You can find which ombudsman and how to get in touch with them in the lobby of the nursing facility. If they still have really stringent COVID restrictions, they also are obligated, I believe, to tell you if you request that information. If you can't find it, let me know, because I know who the ombudsmen are in our area, and I'm happy to connect you with them. They can be very, very helpful. They are impartial. They don't work for the nursing home. They actually are contracted with the state. And they're all over the state. So they can be super helpful in resolving discrepancies in care, in accounts, what kind of access you're having to your person, all things like that. Now, they're not miracle workers, but they're pretty good. So when we're working with somebody who is in a, who identifies as LGBT or lesbian, gay, bisexual, transgender, queer, questioning, intersex, and then A can be all kinds of things. But when we're working with folks who identify using LGBT, I just want to say, please keep in mind their entire lives. At any moment, they could lose their jobs, their housing, their health insurance, any number of things, if anybody thought that they were gay. And just recently, that has shifted a little bit in terms of employment. However, in the state of Michigan, it's still legal to do a fair amount of discrimination based on the thinking somebody identifies as LGBT. So Affirmations is in our area. They serve anybody. And then Sage Metro Detroit, they actually serve older adults who identify as LGBT. So these are some more regional supports. MDHHS sometimes can be helpful. I'm going to be real. Sometimes they can be helpful, and sometimes they cannot. It's a maze, like lots of other systems. Social Security Administration, particularly in financial abuse, somebody's taking somebody else's check, they're not allowing them access to funds, things like that. They can be an unlikely and sometimes difficult source of help, but valuable nevertheless. I'll tell you, I'm not here to, particularly sway you. I always think more information is better than not enough. If the person's faith community is supportive, and this is a tricky one, if the person's faith community is supportive of the person. That faith community may be able to provide some supports to help that person transition out of that abusive relationship. More often than I care to admit, I've worked with folks where both people in that dyad in that couple are embedded in their faith community. And one leaving and one coming out about abuse, not so good. And so for some people, they have to choose, do I live with the abuse or do I leave my biggest source of support? That's a tough choice, and I don't know that there's a right answer. And then the National Alliance on Mental Illness can be very, very helpful. They have a lot of support groups, resources, information, pamphlets, all kinds of stuff. So I always recommend checking them out. Now, when we're talking specifically about financial abuse, surprisingly, although it may not seem like it, all FDIC and NCUA agencies, you can come here, it's okay. All of our financial institutions are required to have some sort of procedures to designate or to handle suspected financial abuse as it relates to their particular institution. So sometimes they can also be an unlikely source of help. There's some variation in how financial institutions address issues of financial or suspected financial abuse. So I'm not going to sit here and say there's a uniform sort of thing responses they're supposed to have, but they need to have something in place. Oh, go finish them. Okay. And then in our area, we are really fortunate to have some grant-funded work at the university. I'm looking at my time. At our university, Wayne State University, called, oh boy, oh my gosh. Sorry about that. Oh my goodness. Okay, there we go. We have Successful Aging Through Financial Empowerment. They are a free service. They help people, particularly older adults, wade through recovering their lives after financial abuse. So they do things like help people get credit reports, make sense of them, contest any incorrect things on there, file police reports, all different kinds of stuff. So they can be an ally. You certainly can make a referral to them. I would just call them and ask and just tell them you need some help. Also, if it comes through the mail, the U.S. Postal Inspectors can be helpful there too. I see there's a couple things in the chat room, so I don't want to leave things. I'm going to check it out and see what I got here. Oh. Looks like I was, okay, hold on. Come on. Okay, well, clearly I'm impaired and I can't do that. So I think I see that somebody was referencing adult protective services or child protective services for the kids. This is their number. You don't need to have all the information before you call them. In those cases, their job is really to investigate. I will tell you once again, I get mixed results in terms of counts of people who have pursued that course of action. Sometimes it's really great, and sometimes they feel like they didn't do anything. So I always put that out there. APS does keep in track of things. I will tell you, well, it's been 5 years now is the latest statistics that I've found. That in our state, the Michigan APS line received something like 26,000 calls about older adults who live in Michigan. And about 5,500 of those were substantiated, which means they found there was cause to think there was abuse going on. Most often it's self-neglect. But it also, so it's really neglect comprises like 4/5 of those calls, is why people are calling. Also, law enforcement or tribal law enforcement can be helpful as well. Not everybody wants to go that route. I totally get it. Of course, in cases of physical abuse, always 911 can be your friend. You know, I always encourage people to reach out, especially in those cases. Sometimes law enforcement gets involved in financial abuse and some other situations as well. Neighborhood legal services and Lakeshore Legal Aid both are nonprofit sources of legal help in our area. I've put their numbers here so you can easily pass those along. And then I'm sure there's lots of really great attorneys in our area too. But again, I often work with folks who have limited incomes. So I'm always looking for like the free or low cost resources. Sometimes health providers can be very helpful. I'm so glad that in the last 20 years, med students have started having courses in gerontology, that they've started having specific units about abuse. A couple of years ago, I went through and taught all the nursing students at Dorsey about abuse. So they're getting that kind of education now, so they're doing a much better job of spotting those things. Sometimes they can be really helpful, and I'll be honest with you, sometimes that's the only person that the survivor of abuse is allowed to see. So sometimes they can be helpful. Yep. Let's just keep on. Let me see if I can make this happen. I apologize. Alrighty, so it's 7:48, which means it's my time to shh and zip it and let you guys ask me questions or make statements or whatever, comments. I'm happy to do that too. Really, I just want to say the best thing you can do is just listen, right? Sometimes that's really what people need, is that space to really figure out what it is they're going to do next about it. Sometimes that can be helpful. Sometimes people need additional help. I do want to make sure, because a lot of people I come across don't necessarily think of elder abuse as a crime, but it is. It very much is. Our prosecutors' offices are busy with it. We're lucky that we live in a state that our Attorney General has elder abuse at her forefront. That's not always the case in other states. The last thing I want to say is there are lots of resources available. If I didn't hit something for you tonight, please don't hesitate to email me. I would normally say call, but right now we're still staggered at the office, so email me. And I'm going to chat and make sure, did I answer everybody's questions or did I need to say something else? Please, what questions do you have for me? Okay, so I see this question. I do want to address this because this is a tricky one right now. So one of our participants wrote in the chat room, oh dear, my mother-in-law's nursing home calls us fairly periodically. It tells us that she fell or hurt herself in some way. We can't see her because of COVID. Yeah, we feel that they are just letting us know, but are they required to? That's a tricky question. And it's tricky because it depends on her admission paperwork to the nursing home. So first things first, like, does she have a guardian? Does she have a conservator? Is there some sort of paperwork that the nursing home has that says they are supposed to notify you in order to make decisions about her care? So that would be one of the questions I would want to ask as a follow-up. If not, then I don't believe that they have a legal obligation 2, I can tell you as a standard of care, most will contact a family member. Okay, so I see there was a follow-up. So this participant's husband is her informal guardian, and that's a very common situation I come across where legally things haven't been designated, but informally this is how it operates. So that is a tough question. Then they're probably calling to tell him, to keep him updated of what's going on. I would want to know, it's worth checking, has she had any medication changes? I believe if they are, and don't quote me on this one, I would defer to a lawyer about this one. But I believe if your husband was to ask for a copy of her medical record or of her medications, that they would provide that. I could be wrong. Please chime in if I'm on the wrong sort of tip there. It depends on the relationship that you have with the facility, to be honest. Hopefully they would be a little more forthcoming. I would be curious, has she had any changes in roommates? Has she had any medication changes? What's going on? Because it's not, how do I say this in the most delicate way? Sometimes medications can cause falling, right? Sometimes a change in medications, particularly blood pressures and some other types of medications, are prone for that. Usually what happens is an increase in care happens, such that until the person gets stabilized on that new med, they they'll increase, I guess, like supervision is what I'm trying to say. You always have the ability to change the setting as well. Again, that might be a really great opportunity to involve the ombudsman as well. So I would encourage you to find out who it is for that particular facility. You're welcome to email me with the name of the facility and I can find out who the ombudsman is there too. Also, I'm trying to remember the exact site. The state of Michigan, they have an ombudsman directory as well for areas. So you may end up finding one that serves Southeast Michigan, but it may not be the actual ombudsman that serves that particular facility. That's a whole lot of detail. I'm happy, again, to give you more if you need it. Okay, so another participant, okay. Hold on, let me stop sharing because I feel like this is not helpful for you. Now, here's my contact information. I'm sorry, I've been talking about emailing me and then I didn't show you it. It's right here. It's mmachAC@D as in disability, N as in network, O as in Oakland, M as in Macomb.org. Yes, and so I'm happy to do that. So let me stop sharing. I'll drop my email in the chat box too. Let me see what else is going on here. I'm sorry, I'm trying to catch up in the chat room. You guys have such good questions. Credit unions are large. Oh, so one of our participants said, I have seen credit unions and large banks both spot elder abuse and report it to APS. Yes. So they often have the paper trail that you need to really do a good job in a court of law. So absolutely. And they risk losing not only, customers, but they also risk coming under increased scrutiny by the federal government too. So they kind of have an interest in keeping people safe, right? Because if you don't have money, then you can't have a bank account. And they don't make money. So, Let me see what else I missed. So here's a good question. What are some good first steps to respond if you suspect abuse is occurring while not potentially further endangering the victim by investigating? Yeah, it's tricky. Tricky. I will say this, if you're not a mandated reporter, it's simpler. If you are a mandated reporter, it becomes quite challenging. And so let me address that first, and then I'll go backwards a little bit. So if you're a mandated reporter, which if you don't know what that's talking about, you probably aren't. Usually licensed professionals have some sort of mandatory reporting requirements, lawyers, clinicians, nurses, stuff like that, social workers. Okay. My sort of philosophy, and I've heard this repeated in multiple professional circles, my philosophy when I was doing therapy and needed to involve APS was before I made that call, I would always have that conversation with my client and say, look, I am obligated to report this kind of thing. So after we finish, I'm going to call and I'm going to, and this is what I'm going to say. I want you to know because I want you to tell me if there's anything else that I need to be including, right? Or anything that we need to be preparing for as a result. But for me, that was the comfortable way because I'm terrible at going behind people's backs. I'm not good at it at all. So I always chose to disclose that. I don't believe that there is a necessary specific course of action that says you have to do it and you can't disclose or you shouldn't. Most people I talk to who are in that position usually have some kind of conversation with their client ahead of time. So I always recommend communicating, and then making sure that you anticipate any of those potential consequences as best you can, right? We're not future readers. Despite my credentials, can't read minds. And so I think trying to anticipate those and working with your client, because you want to keep that relationship as much as you can, because you may be the only person the person is told. That sounds super redundant, and I apologize. But you may be the only person. I think that's where your empathy, that's where your listening really comes into play. Keep in mind that people who have survived in an abusive situation oftentimes have been made to feel like they don't know what's true and what's false. They've been made to feel like everybody else is the enemy. And they may have, distrust totally outside of the abuse, but because they don't identify with the dominant culture or the dominant group. So they're naturally less open about it, I guess is what I'm trying to say. So sometimes that empathy and just saying, yeah, man, that sounds tough. How did you do that? Sometimes that's helpful. If you give any numbers, phone numbers, I particularly like. I used to do this when I worked at a domestic violence shelter. Don't give business cards, just give a number. Don't say who it's to. You can verbally tell the person that. You can provide I've also heard people say, I saw this person and I thought they were in trouble. So I just handed them my email and said, if you need anything, email me or call me. And sometimes that's helpful, right? Because the last thing you want to do is provide some incriminating evidence that somebody who is physically abusive to another finds, and that becomes a cause. Because I will tell you, when people tell you they are afraid for their lives, they are legitimately afraid for their lives. I used to work graveyard shift, and it's 8 o'clock, just check it, at a domestic violence shelter. And I can't tell you how many people came in who literally came straight from the hospital, police escorted, who you could hardly figure out what they look like underneath all the bruises and broken bones. That's a legitimate fear. So I think just having that open space, that acceptingness can really help start to break some of that down. Yeah. You know, it's a practical matter. I'm sorry, I'm catching up again. As a practical matter, as mentioned, a healthcare provider, visiting doctor, or someone who is authorized to see her would be a good source of information if you are authorized to speak with medical people. Yes, absolutely. Yes, you can always request to speak with her provider or the nurse on staff or the ADON, the administrative director of nursing. Things like that, they can help as well. Okay, so we have another question here. I'm going to go ahead and answer these questions and just keep going. So if you have to go, I get it. My dad is in an assisted living rehab facility. We get calls about falls in aid too. I've also received a full medicine list when I request it. I have been able to speak with the PA. Perfect. I requested remind me, FT. I can't remember what FT is. It's therapy, but I can't remember. Finger therapy. I was like, I can't remember. I'm blanking. I don't know. With my dad, so I can at least see him. FaceTimes. Oh my gosh, I think I just showed my age terribly. Yes. Oh my gosh, yes, I'm officially Gen X. I just want to point that out. I don't know these newfangled terms. Yes, so sometimes staff is extremely accommodating, and you know, we're all in this weird time where nothing is quite how it used to operate, and so I think there are good things about that, but also bad things about that. So it depends on the facility, honestly, and how much they accommodate those things, to be honest. I've seen it all over the spectrum. So I'm so glad, Deborah, that you have a decent experience, you know. Okay, so I have another question here that says, any suggestions about where to look for financial resources for the elderly? Mostly housing subsidies without having to share a room in a nursing home. Yes. I always think it's a weird thing where people have had their own bedroom for their entire lives and then suddenly have to share a room with somebody who may be actively psychotic or any number of things. So financial resources, housing subsidies, I'll start with the easy part. In a nursing facility, I don't know of any subsidies that would allow that. Yeah, I don't know of anything off the top of my head. If we're talking independent living apartments, yes. So sort of the usual suspects, I guess, in terms of finding there is housing that particularly caters towards older adults, but also qualifies as low-income housing, so it has that subsidy attached with it. And those are really the biggest ways that I know people are able to at least be able to find a place to live. I can talk to our information and referral specialists and see if they know of any new things that have come up since COVID, because those are my sort of go-to standbys. So let me chat with them. Feel free to send me a quick email so I have your contact information. I will be happy to find out some more for you because that's a really good question. All right, so I see, wow, I'm going slow through these. Sorry. Are there statistics about elder abuse with in-home caregivers versus nursing? Thank you for the clarification. You know, they are, that level of distinction isn't always so readily available, and I would say empirically rigorous types of research. I will say on the world stage that we have a lot more information about nursing facilities across the globe and elder abuse within those nursing facilities. In the slide about the 5 different bubbles with the different numbers, and the one where I was like, oh, 60% of it, it's usually a well-known person that is perpetrating the abuse to the survivor. Next to that one is 1 in 3, which I didn't highlight, but 1 in 3 nursing facility employees admit to either themselves or witnessing emotional abuse in the facility. And that comes from a WHO study. And so they were looking worldwide. I'm amazed that they got that kind of reporting, but they did. So I'd have to look a little more to see if anything new has come out in terms of parsing out in-home caregivers versus nursing facility caregivers. So I don't have a more clear answer about that. All right. Okay, so I see, I apologize, I had to turn it, yeah, that's fine. No, welcome, Carla. Briefly review what to look for if you suspect a family member of financial abuse and how best to document this. Thank you. Yes, absolutely. So, yeah, it can be very sneaky. And part of it's sneaky because financial abuse covers a lot of different things. So it's everything from I'm going to Walgreens to pick up some lotion and some shampoo for my grandmother. She gives me a 50 and I give her 20 back. I mean, depending on the lotion, it could be, but it's unlikely that I spent $20 on just Suave shampoo and lotion, right? That's an instance of financial abuse. It can be that simple and repeated over time. It can be a little more sneaky, and that family member has convinced your loved one to sign bank documents to add them as into their account or set up a joint account. So it can be that. I will tell you, once it gets to a joint account, it becomes much trickier to parse out financial abuse, because in a joint account, both account holders have equal access to that money, no matter where it came from. And so it becomes a little more challenging in those cases. You know, I would look for, again, those unpaid bills. And I will actually share my screen and go back to those questions that I tend to ask in situations where I suspect financial abuse. So hold it, please, while I go back. Whew, maybe I can make this work better. All right. Yes, no, is it gonna behave? Oh, here we go. Go to slide. Bear with me just for a second here. Okay, this one. Is your loved one accruing past due bills, even though that family member is supposed to be paying those? Are they pocketing money? Are they siphoning off money? Are things not hanging together? Is your family member missing necessities? Are they not being able to afford medications they previously were able to afford, not because the price has increased or the insurance changed, but because everything has stayed the same, and except this family member has come into the picture? Does your family member have limited access? does your loved one, which is the person I'm imagining might be surviving financial abuse, does your loved one have limited access to their finances because of that family member? Those are all things that I would start to be asking or just observing and seeing if I can find answers to those questions. If your loved one is complaining about not having certain things that they previously could afford and there hasn't been a dramatic change in income, that would make me curious as well. Hopefully those things are kind of helpful to get you started. I'm more than happy to talk more about this. I'm way more happy to talk about this later. Sort of along those lines, I do want to make sure one of the things that I do or I recommend to people is if you are the one who is managing finances for a loved one, I will have to come across it. No, I don't. I know it. That SAFE program, the Success After Financial Exploitation program, they have actually published some online tools that you can use to try to, one, see if there's anything kinky going on, but two, also give you some really good guidelines for how to manage somebody else's money in a way that protects you. So there are some ways that you can document. I've known people, and these have been like accountants, so not the average person, but I have known people who have deliberately made like budgets and spreadsheets and all kinds of stuff and kept receipts so that if they ever got called to court, they had the evidence to show that they did not intentionally financially abuse their loved one. So I think documentation can really help you set the record straight or really lead you to a case where there might be some financial abuse happening. I hope that helps. Again, feel free to contact me outside. I'm happy to have more conversations about this. I will, okay, thank you so much. One thing I will say is at the beginning in the chat box, I dropped an evaluation that I would love for everybody to fill out. Please be honest. The only way that I get better at this is if you tell me I'm not doing something good. And also I have to turn around and report on my activities to my funding sources. So thank you so much, everybody, for attending. And I really appreciate it. Please do contact me if you ever have any questions. I'm always here. And don't forget that my agency serves everybody with disabilities of all kinds. Thank you. Have a wonderful night.
Yeah, thank you very much, everyone, for joining us. We appreciate you coming out. Have a good night. We hope to see you all at a future program. Thank you again, Melissa, for hosting this wonderful event. Michelle for attending.
Thank you so much for having me. I really appreciate it.
Thank you all. Have a good night.
Good night.